Hi everyone, thank you for tuning into this biweekly video, and I'm here in the Hughes Fine Arts Center and joined by Professor Carly Flaagan, who is the director of our music therapy program here at UND. Carly, welcome. It's good to see you.
Thank you. I'm so glad to be here with you.
And I figured our viewers would want to hear a little bit about you, so tell us about yourself and what you do here at UND.
Sure. Well, I'm a local. I grew up in East Grand Forks, and I was in my choir class my junior year when a previous music therapy faculty member came to talk to our class about music therapy. At the time, I was deciding what should I go into, what am I interested in pursuing in terms of a career, and I was between healthcare, psychology, music, and then loosely something that helped people. And this faculty member said, music therapy is a combination of psychology, healthcare, helping people, and music.
Home run.
Done.
Yeah.
And I haven't looked back since. Came to UND, so I'm an alumni. Completed my undergraduate degree here in music therapy. Had a great, fulfilling experience. Went to San Diego for an internship. Came back here for 2 years, practiced. Went to Colorado for my master's. Practiced for 8 years, started an internship, got really into neuroscience and music, got super nerdy about it, and then now I'm here.
That's incredible. Yeah. And so you came in through the music therapy program, and
yes, I did.
And then you must have heard the news at some point that UND was going to restore the program. What was your reaction when you heard that news, and what did that mean for you?
Yes, it was a really complex and layered reaction, but primarily I was feeling relief because I'm so passionate about music therapy and the prospect of educating more music therapists that I was really relieved that North Dakota would once again have the only program for educating music therapists.
Yeah, incredible, and it's glad. I'm glad for sure that the program is back.
Yeah.
But many people, the viewers, might not know exactly what music therapy is. So what is it?
Yeah, the question of the hour. And I'm asked this question whether I'm at the beach or whether I'm out at the library. So I love to answer this question. Loosely and broadly put, music therapy is using music to improve quality of life. But it varies depending on the music therapist's approach, the setting where a music therapist works, and then the population or the people who a music therapist works with. So how I practice, which I guess is most relevant here, is with this definition. I think of music therapy as using music as an agent of change to improve quality of life or healthcare outcomes across the lifespan within an established therapeutic relationship. And I'm usually working for myself and how I practice on non-musical functional goals. A lot of people might look at music therapy and think, well, the goal is just to improve at your music skills, or the goal is just to feel better. But I'm looking at goals across the spectrum for any individual, across motor realms, physical realms, cognitive realms, psychosocial, emotional, spiritual, communication, sensory integration, processing. We can do it all. So it's a dynamic field.
Yeah, and given all those components that you talked about that come together, very science-based, and it seems like it has a tremendous impact on the patients that you work with. So tell me about this. So a therapist goes into a session.
Yeah.
What's going on in their head as they deliver or design a therapy session?
I love this question, and I wish more people asked it, so thank you so much. I want to start with this. When you look at a music therapy session, you walk in, you're going to see something that looks really fun, simple, basic, 2 or more people engaging in music making or music listening of some sort. You're not going to immediately think that there's a clinical aspect to it, but in the music therapist's head, there's intense clinical decision making happening at every stage of the session. And that's why we need a degree to be able to practice it. We need a degree, a 6-month internship, and then we have to take a board certification exam. And that's because we're taking all these classes that give us the science, neuroscience, anatomy, psychology, and the music background to be able to manipulate the music to best promote healthcare goals. So we're thinking about, how is our music supporting the client in this moment? If we're working on motor skills, we've got to think about the spatial cues of the music. So is the pitch going up when the arm is going up? Is it matching it going down? We're thinking about temporal cues, so how fast it's going. Is it appropriately challenging for the client in the tempo? We're thinking about force cues. Are we adding an extra oomph to our chord as we strum it? We're thinking about the meter. Is it a hinged movement? 1, 2, 3, 4. Is it a rolling movement? Then we change to 1, 2, 3, 4, 5, 6, 1, 2, 3, 4, 5, 6, 1, 2, 3, 4, 5, 6. That's just in the music and just one part of it. We're thinking about dynamics and client preference and Is the client staying motivated? Do we need to create some changes? The list goes on and on and on. And on top of that, we're thinking about client safety and overall client experience.
Yeah, so tell me, you mentioned the certification. So one can get an undergraduate degree in music therapy and then pass the boards and become a certified music therapist?
Yes, with that 6-month internship in between.
Right. So no need for a master's degree then?
No need for a master's degree at this time, but you can get a master's and you can get a PhD in our field.
Wow, incredible, incredible. How are healthcare systems actually bringing music therapy into the fold and using it as part of the care of their patients?
Yeah, so the integration of music therapy into healthcare systems is seamless and the possibilities are really endless. Think of any specific section or place of a hospital. A music therapist can be in there and be instrumental in helping any patient progress towards getting out of the hospital, have a better experience in the hospital, or achieving goals within the hospital. So in a NICU, a music therapist can be there to help support those little premature babies in developing sensory integration and processing. It also tends to increase their ability to feed following a music therapy session, thus helping and supporting their neurodevelopmental health. In a cancer center, it's a great way to provide an outlet for expression and also to distract a patient while they're undergoing chemotherapy or receiving an iron transfusion. In a pre-operative room, pre-surgery, music therapy can help decrease anxiety, decrease stress, which then decreases the need for pain medication, making music therapy cost-effective. And then the list just goes on. Rehabilitation centers, music therapists are really great parts of the healthcare team in terms of restoring functions that are lost following traumatic brain injury. And we could have 2 more hours.
Yeah, it's incredible. It's incredible.
Yes,
So one final question that the viewers probably have, with all the excitement around this program, how does one get more information about our music therapy program here at the University of North Dakota?
Yes. You go to und.edu/music, and right at the top of our page, there is a little hyperlink that says learn more about music therapy, and it'll take you where you need to go.
Wow, it's that easy.
It's that easy.
Well, let me thank Carly for you being here today, and we really appreciate the insights that you've given everyone on our new or returning music therapy program here at the University of North Dakota. And to all those out there, let me thank you for tuning in and also recognize that this is Native American Heritage Month, and so make sure that we as a campus come together to honor the rich contributions of our Native American colleagues and friends in society and take an opportunity to learn a bit more about their cultures and their traditions. So until next time, we'll see you then.